My priority is to keep Australians safe. That is the priority of our government as we deal with what has been an emerging situation with the coronavirus. Each and every day there are new developments in relation to the coronavirus, and I want to thank Dr Kelly, I want to thank Dr Murphy, I want to thank all of those who have been involved in providing advice to the government, also at the state and territory level with the medical officers there. Earlier today the National Security Committee met for 3 hours to consider the next round of advice and information we've been receiving in relation to the coronavirus. What has occurred in particular in the last 24 hours or so, as the data has come in, is that the rate of transmission of the virus outside of China is fundamentally changing the way we need to now look at how this issue is being managed here in Australia. Now, I want to reassure Australians that as we speak here and now, we have had 15 cases that have come from Wuhan, and all 15 of those cases have now been cleared and are now back in the community, having been able to move on from the virus. There are 8 other cases that were imported from those who came on the Diamond Princess. There are no other cases here in Australia, and there has been no community transmission, as Dr Murphy would say, here in Australia. So the actions that the Australian government have taken, and that included getting out well ahead of the World Health Organisation at Dr Murphy's, I think, very insightful advice, with the measures that we initially took at a time when the WHO had not even declared it in the context that it has now been declared by them. The advice that we've received today is very similar to that, and that is that based on the expert medical advice we've received, there is every indication that the world will soon enter a pandemic phase of the coronavirus. And as a result, we've agreed today and initiated the implementation of the coronavirus emergency response plan. As you can see, it's a very comprehensive document. I want to commend the Department of Health and all of those who have been involved in ensuring that this plan is in place and ready to go. So while the WHO is yet to declare the nature of the coronavirus and its move towards a pandemic phase, we believe that the risk of a global pandemic is very much upon us, and as a result, as a government, we need to take the steps necessary to prepare for such a pandemic. And so earlier today, I instructed through the NSC, the Minister for Health, to be engaging with the state and territory ministers, to be bringing back the plan to identify any gaps in capabilities at the various stages or levels at which a pandemic may proceed to. I want to stress that these actions are being taken in an abundance of caution. We have always acted with an abundance of caution on this issue, and that has put Australia in the strong position we are in to this time in being able to contain the impact of this virus. So the actions we're now taking in being prepared even further is to ensure that we can respond immediately when the virus moves to the next level. We've also asked the Commissioner of Border Force to be reporting to us as quickly as possible on additional measures that would be required at our various ports of entry to ensure we're able to identify any persons coming from wherever in the world that may require additional information in terms of being self-quarantined or other forms of quarantine that may be necessary as this issue continues to roll on. In relation to schools, I've tasked the Minister for Education to engage with the education ministers from the states and territories. I want to stress, and I'm sure Dr Kelly will reinforce this point, there is no evidence before us that children are in any greater risk as a result of what has occurred more recently, but we do believe, to take care of our kids, that we need an even greater abundance of caution to ensure that should the coronavirus move to a very extreme level, or there is any particular risk that is associated with children, particularly those attending school, that we have the preparedness and the arrangements in place with states and territories. And I want to thank all of the state and territories for their engagement, whether it's on this issue on schools or the many other issues, the health issues that are associated. I've tasked the Minister for Home Affairs to be working with his counterparts in the states and territories to ensure continuity of service, continuity of operations plans are in place, and that we're aware of any gaps that would need to be filled at any and every level of what the virus may extend to. Again, I know the states are already working and are well advanced with their own plans on these issues, and I commend each of the Premiers and Chief Ministers for their leadership in ensuring that they're taking the same actions as we are to ensure continuity of service in more extreme cases. There is no need for us to be moving towards not having mass gatherings of people. You can still go to the football, you can still go to the cricket, you can still go and play with your friends down the street, you can go off to the concert, and you can go out for a Chinese meal. You can do all of these things because Australia has acted quickly. Australia has got ahead of this at this point in time. But to stay ahead of it, we need to now elevate our response to this next phase. I said the other day, this is a health crisis, not a financial crisis. But it is a health crisis with very significant economic implications. The Treasury Secretary and, of course, the Treasurer, who is a member of the National Security Committee, was part of those discussions today, and he and I made some comments on these matters several days ago. What the Treasurer is working on with the Treasury is the advice is that if we are to take any actions here, and that is still subject to advice from Treasury, which have not confirmed their advice, that any such measures would only be effective if they were targeted, modest and scalable. And we are quite aware of where the virus is impacting in particular sectors more than others. Obviously in the travel sector, it's having a very big impact, in the education sector, but also, as I mentioned the other day, the impact of supply chain breakdowns, not just now between Australia and China, but in a more broader global pandemic stage, those impacts would also be quite relevant. And so we're aware, particularly in the export industry, in the marine sector, there are particular issues there, especially in North Queensland, but these problems are presenting in many other places, and the Treasury is doing that work now, and the Treasurer will be leading a response to that. But the advice is also very clear that as Australia goes into dealing with this issue, the financial stability that is present is a big plus for Australia. Of all the countries that are prepared and are in a position to be prepared, I'm glad we're in Australia. And I'm glad we're in Australia where we're able to have these types of responses. We have the financial stability to address this, and we have one of, if not the best health system in the world to deal with the great challenge that can come with a global pandemic. So, as the health ministers want to say, we are not immune to this, but we are well prepared, and we are going to be even more prepared as a result of the actions which I've initiated today as part of the National Security Committee process. And that means getting on with the plan. Got a plan, we're going to get on with the plan, because at the end of the day, it's about people's safety.
What's happened this week, of course, is that we have seen outbreaks in South Korea and Japan, in Iran and in northern Italy. And indeed, from Iran and in northern Italy, there's significant evidence that cases associated with each of those countries have led to cases in neighbouring countries, whether it's been in Croatia or Switzerland, whether it's been in Kuwait or other countries within the Middle East. As I mentioned earlier, in the last 24 hours, we've seen 4 continents have first-in-country cases confirmed. And when that involves Africa and West Asia, Europe and South America, that's a very significant moment. On the 21st of January, Professor Brendan Murphy, as Chief Medical Officer, got well ahead of the world and declared that this was a disease of pandemic potential. That triggered a series of actions for which we had prepared in terms of the National Incident Centre, the National Trauma Centre, the work of the Australian Health Protection Principles Committee. It's led to cooperation with the states. It also involved the development of the pandemic preparedness plan for coronavirus. Given the events of this week, as the Prime Minister said, National Security Committee today heard of the high likelihood, the high probability that the world would soon enter formally into a pandemic stage, which has led to the invocation and the implementation, the activation of the coronavirus pandemic preparedness plan. That means we're now at the first stage of that plan. And tomorrow I'll be meeting with the state health ministers, territory health ministers. I want to thank them, as the Prime Minister said. In particular, we're looking at the elements in this part of the plan. We're taking advantage of a meeting which I think it's important to acknowledge was already on the agenda. Coronavirus was already on the agenda, but as a consequence of this, we have sent out inquiries to all of them to fill the items which we want to look at. Supply chain management, to make sure that there's surge capacity, if required, further down in relation to our hospitals and our medical facilities. The preparedness of state health systems, preparedness of critical medicines. They're all the things that we now move towards. The preparation of potential fever clinics in case this were to evolve still further. Having said that, we have achieved containment so far in Australia. I think that's very important. We have achieved containment so far, but when we say we're not immune, we say that for a reason, because now that it's spread to 42 countries, the high likelihood is that somewhere, sometime, there is a further round of cases that may make it to Australia. And if this becomes a truly global event, a truly global pandemic, then it is overwhelmingly likely to have some effect. But we say that to say to Australians, we've sought to anticipate, to plan, and then to activate. Today we are activating something which we had anticipated, for which we planned, and that ultimately is about saying to Australians, we'll get through this, we will keep you safe, we'll do all that we can, and as a country, we are well prepared.